Welcome to Laugh Through It All. I'm your host, Tracy. Join me as I talk to Dr. A, MD, board certified dermatologist and owner of Modern Dermatology, Michigan. How can someone determine their skin type?
So, a lot of it is when I'm talking to patients about like if they, how many times a day do they need to wash their face? And when they do wash their face, does it feel oily or do they feel like they need to use moisturizer? Like if they have like flakiness on their skin. And sometimes patients will tell me some areas are dry, some areas are oily, or everything is dry or everything is oily. So it kind of depends on like when they wash and like if they feel like they need to use like a moisturizer every day.
Okay, so there are people who shouldn't, so if you have oily skin, you don't use moisturizer at all.
You can still use moisturizer, but a lot of times we use like oil reducing topicals to kind of reduce some of that oil and then like help with like the pores and like texture of the skin. So a lot of those things can cause dryness. So we may just balance it by using a little bit of moisturizer.
I have like I guess you would consider like dry to normal skin for the most
Hmm.
part. I've never had oily skin, but I do have, especially right now, of course, because of the winter, it gets a little bit drier. So is there any specific things for like dry to normal skin that I should look for?
So, like, if you're looking for like an over-the-counter product, I like things that have like ceramides. Those help repair like the skin barrier. And then I like moisturizers that have like a peptide. So this is like when they do like double duty, and like peptides are really great for like helping collagen and elastin and like helping the tone of your skin. So I like to use like one product that does like two things. So I look for moisturizers that have like peptides and ceramides, and that's gonna help kind of moisturize and like do other things too. So it kind of like saves you a step like in your routine.
And what are some ingredients that you should definitely avoid in a skincare product?
So if you're on the dry side, a lot of times people want to use something for like wrinkles and texture, and like some of those products like encourage cell turnover so they can make you drier. So, they don't necessarily have to eliminate it, but training that person in like how to use something like that, like usually there's like a wean on period to it. Like they may have to do it like 2 to 3 nights a week and have their skin build tolerance. And like during that time, they would just have to use like a lot of moisturizer. So they can still use certain things, but it's just like the way they use them is what's important.
Most of my listeners are within the age range of like 40, I'd say 40 to 60. So what do you
Mhm.
think are some important things that, we should be looking? I'm right in the middle. I'm 51. So, what
Mhm.
are some things that we definitely should be looking for?
So daily, I always recommend like even just like keeping the routine like super basic. So morning, I just have patients like wash their face, and doing like a vitamin C serum. Now that is something that's like pretty like universal for like any skin type. It helps with it's an antioxidant, so it helps like with brown spots. It also supports collagen, and it's like really easy to tolerate and use. And then typically I'll just put my sunscreen on top of it. Now, when it comes to nighttime, I have patients make sure they use a retinol. So we want to take care of like wrinkles, texture, pigment, pores, fine lines, all those things. The retinol, which is like a vitamin A derivative is like what I recommend using in the evening.
Now, I've always had pretty good skin, thankfully. But I do have like spots. Is that I like to call, oh, my mom likes to call them sunspots. Um, are those like if I just have some, a bunch of different little, not on my forehead, but all through here are
Mhm.
just spots. Are those age spots or are those sun spots or are they a little bit of both?
They're a little bit of both. It's we get them from the sun, and then with time we just like accumulate more. So it's like if we don't use anything now to treat them, we will just continue to get a lot more in the future. So, some of this is taking care of like the active spots you have, but also reducing more spots like in the future too.
So that's vitamin, so I would need vitamin C to help with that.
So that helps with reducing like the brown spots, and retinol helps with reducing that brown spots and also preventing more too in the future. It turns your skin over, so it encourages the cell to exfoliate and regrow, and that way it supports like a longer lasting like anti-aging part of it.
I would really like, and I know these are so popular on TikTok because I watch them all the time, and I think that's what sparked me to want to do this with you,
Hmm.
is drugstore finds because I have tried doing the skincare regime from like where I would get a facial from, and
Hmm.
that just isn't doable for me. I can't, they feel great, and I did see a difference in my skin, but it's just not affordable. So, do you have some things that you like and that you recommend that we can find at the drugstore?
Yeah, so I like there's a lot of like different like vitamin C's and like retinols over the counter. And I usually just recommend to patients maybe starting off with only like one thing at a time, making sure like you tolerate it and then like you build up to your routine. So I mean like La Roche-Posay has a great vitamin C. It's like a 10% vitamin C serum that you can get over the counter. And some of these products do have a little bit lower potency, and then patients may want to build up to something a little bit more potent down the road, and they'll typically look for like in-office products. But I think starting off in like a pharmacy drugstore is great as long as like they're developing that consistency. So the La Roche has a great vitamin C, and that's pretty affordable.
And you said 10% is really what you want, but you should work up to that.
So 20% is kind of what I
Oh, 20.
recommend. If we're looking
Okay.
for different like over-the-counter products, they range between like 10 and 20%. The trick is with vitamin C, it's like the delivery of it onto the skin is really what we need to look for. It is not a very like stable molecule, so it disappears like in within like seconds to minutes of like putting it on. So the topical over-the-counter ones are great. They might just not last as long on the skin as we want them. So down the road, I would say once patients like develop like a good consistent routine and they want to try something that's a little bit longer lasting, it is a little bit more of an investment. But if they get the basics of it, even that makes a huge difference.
Okay. So vitamin C, and then what face wash would you recommend?
And a lot of times I'll ask patients like the same thing that you mentioned, like what skin type are you? So if they're dry, there's great gentle cleansers like CeraVe has a great hydrating cleanser. And La Roche-Posay actually also has a great hydrating cleanser too. If you're more on the oily side, there's certain ones that you can get over the counter, like Cetaphil and CeraVe also both make a great, more oily prone foam cleanser. So those are the kind of products I like geared toward like that skin type.
And what about the moisturizer then? Brand
Moisturizer, oh,
that's
there's so many
good.
good ones. I think it depends on like how much you want to spend on something. Like Cetaphil, CeraVe, those make great basic moisturizers to use like on a daily basis. I like Neutrogena Hydro Boost if you tend to be dry. It's a little bit more of like a water-based gel, and it's like a little bit lighter on the skin. You can also do something with like hyaluronic acid in it. That's kind of like another step in a moisturizer. It helps attract moisture into the skin. I like that for like really dry patients.
Now I know there's all different kinds of serums and everything else. So vitamin C, what else for our age group would you recommend in, adding to our daily routine besides vitamin C?
So evening, I'd recommend like starting that retinol. That's kind of like a vitamin A. That's the good one for like wrinkles, fine lines, texture, cell turnover. That's going to be an important one to use in the evening. The Rock has a
Oh,
great vitamin A line. Sometimes I do recommend like you have to like work up slow to those because sometimes patients will use them, they get like red and dry, and then they don't want to use the product anymore.
right.
So,
Right.
because you're seeing that cell turnover much quicker than you would if like you like weaned onto it.
Weaning on meaning just don't use it every day, use it every other day or every,
Yeah, usually I'll say like
okay.
do it every other day. If you get dry, you skip a night. If you're not dry, then you use it. But as long as you're still consistent with how many times a week you're using it, because some
Uh-huh.
people will do it a couple days and then they won't use it for a week and then they'll use it here and there.
Right.
It's really that rhythm of using it every day that is what's going to be the most important.
I have a heck of a time with eye cream. I just with my age again, I've had very good skin, but I have, you can even see them. I have such bags under my eyes. How do I know
Mhm.
if they're, well, I guess it's a two-part question. How do I know if if they are bags and this is a shadow, or if I just, have dark circles under my eyes? Does that make sense? Like if it's a
Well,
pigment or if it's the shadow that it's there.
so some people will have more of a blue pigment, and that can be from like if like you're tired or if you're anemic or if you're dehydrated. And that sometimes is something where we have to build up the actual barrier and like use something that's like more moisturizing, something that contains like a peptide. Then there's like the bag part of it that has like swelling to it. And that sometimes we need something that like reduces like that actual puffiness to it. So,
Okay.
and everybody's a little bit different.
I need something for that. I try a million different products. You know what I try is a lot of the products that, kind of tighten it for a minute, but then your makeup looks terrible. And I even actually came to your office and I didn't see you that day, but I said, can I get like a filler or something there that'll, that'll bring it out, and they actually said that no, that it really isn't, that that wouldn't do anything for me, which was discerning, but I need to find something.
Yeah, if we have like under eye like puffiness, filler is going to actually just accentuate that area.
That's what she
Filler is
said.
great if like you have like deep hollows and like loss of volume. If we put filler and like you have puffiness, like that actually might even attract the water to it. That makes it a little worse. Sometimes like surgery or like a skin tightening procedure might be the best route.
God
So a
forbid.
little bit more extensive, but
Yeah, quite a bit more. So what could I try then? What
yeah, there's this Neutrogena rapid wrinkle repair for the under eyes that I really like, and it
oh,
does have a retinol in it.
okay.
So you have to be careful with that too because the under eye skin is much more fragile. Usually I'll use my retinol eye cream maybe like 3 nights a week, and then I use a peptide eye cream the other nights of the week. So I kind of have to balance like the dryness with like moisturizing part of it, but I still want the benefit that the retinol gives me.
Correct. Yes. Because that's what I find too, is that those things will dry out my under eye, and then
Mhm.
um and then again my makeup, and I don't wear a lot of makeup as it is, but that makeup will look cakey.
Yep, yeah, because that exfoliation part of it just like attracts like all that makeup to sit in the creases, and like that is, that's not the look that we want. So
Right.
it might even just be using it like 2 to 3 times a week, and you'll still get benefit from that. But it's like you have to consistently do that long term to see the
Sure.
benefit.
I do know, which I mean, I have, hopefully told my daughter this too, is the most important thing for your skincare is definitely to wash your face every day. Right? Wouldn't you say that, and sunscreen are the two most important things?
Yeah, I would say cleansing, sunscreen, those are the big ones. A lot of people like just don't use sunscreen on a regular basis. Like even in Michigan, like they don't use it in the winter time, and it's kind of like, really like how much you invest in your skin is like what you're gonna get back.
Well, I find that the sunscreen, I'm gonna be quite honest, I'm not the best at wearing it every day on my face. I 100% wear it if I'm out in the sun, if I'm gonna be out in the sun for a while. But I find that they're either thick, or, they just kind of put a different, I don't know, a different feel to your face.
I think it depends on like the kind that you get. I always recommend using like a mineral-based sunscreen. So
Okay.
that's something that has like zinc or titanium in it. Some of the ones that are chemical sunscreens can actually like burn your skin, like if you have sensitive skin. So I can
Right.
only use like the mineral-based ones. And they do have some formulations where it's like not super thick and cakey. It's a little bit more of like what we call like a nanotechnology. It goes on a lot more sheer, and it's a lot less like noticeable. So I like a tinted one. We have a great one that we have in our office actually that's like tinted, it's a mineral, and
Mhm.
that's like really light. And there's like tinted over the counter ones you can get too. And it's just like almost like a makeup. So that way it just becomes like part of your routine.
Sure. Also, what I did, I changed is, for years and years and years, I would wash my face and then I would just dry it with the hand towel. And then I after all these years, I'm thinking, oh, I saw my son was doing something with his hair and then took the towel and did that. And I'm thinking,
Yeah.
oh, Michael, I dry my face with that. Then I'm thinking, wait a minute, I got to come up with something different because I can't use this hand towel to dry my face. So I've been using these, I mean, this is just from Amazon, these clean towels, these throwaway clean towels. And I think I really like using those. Because you can dry it once and then throw it away. I mean,
Mhm.
maybe it's not the most economical, but I 100% think that that has made a difference in my face also.
Yeah, I agree. What we should be washing our face with is probably something different than what we should be washing our hands with, just because the amount of germs. And it depends, like, yeah, if you have kids, those are going to be maybe not as clean if we're washing like hands with
Yes.
them.
I know. I think back to it, I think how disgusting. Like I clean my face every day, and yet here I am drying it with this germ infested hand towel.
Well, I have this like microfiber towel that I use for my face, so it's reusable because I,
Oh,
I had some of those cleansing cloths, and it just gets to be like a lot of like, waste, and they're kind of expensive. But I
yes.
have a microfiber towel that I use, and I use it to take off my makeup, and then the other side of it, I use it to like wash my face every day. So, and it's really gentle on the
Oh.
skin too.
So a microfiber towel.
hmm They have
Okay.
specific ones like just for the face that are like really soft, so that way they're not like abrasive to the skin.
Okay. Where do you find that so I can look on
You
it?
know, I think I got mine on Amazon. They have them
Amazon?
everywhere. Yeah, that
Okay.
might be the easiest place to find that, but they have them in drugstores too.
Okay, fiber towel. Because I like that because then I could get a few of them and then, just wash them and, wash and dry them.
Hmm. Yep.
Um, Now also another thing is, should I be using like to wipe all my makeup off first before I cleanse my face? I have
I mean,
always just used soap and wash it all off, and that's it.
you can just use the cleanser now if you have like a lot of makeup on. Like sometimes I will use like a makeup remover on my microfiber towel before I take that off so I don't have to like scrub as hard.
Okay,
But you can just use like your cleanser too if like you want to, just like for a daily basis. That should be fine.
that's fine. And just do it once. I don't have to do a repeat on it.
A lot of people like to do what we call like double cleanse.
Yeah.
I think that's great if like you're oily or if you wear a lot of makeup on a daily basis, but I would say normally I just cleanse once and then I
Okay.
dry and then just finish my routine.
Okay. All right. Yeah, that's good to know. I've always had a little bit of a sensitive skin, so some of those makeup removers are
Hmm.
sometimes a little bit too much for my face.
Yep.
Because I've tried those Neutrogena wipes, I think they were, and though my face did not
Yeah.
like those very much.
Certain makeup removers do have like formaldehyde products and derivatives in them. So
Oh,
especially the ones that have those like the wipes with them. So my favorite one is by Almay. You can get it at like
yeah.
CVS or Target. And I think that it is like a little purple clear bottle and it's for sensitive skin. And it's just like this like little bit like of an oil based like cleanser and it just like really just takes off all the makeup and you don't have to scrub. So it's like really easy, especially around the eye where you don't want to be too like harsh on the skin. And it just
Right.
comes off super quick. I think it's like $6 for a bottle. It lasts like a year or so.
It's funny you say Almay because when I was growing up, Almay was a good product, and then came Clinique, and
Clinique, yeah.
yeah, because I say Clinique, and the toner used to bother my face too.
Yep. So if you are more combination or on the dry side, toner is just going to remove some of those oils on the skin. So I typically don't recommend toning if you are more on the dry side.
Oh, very good to know.
I think
Okay.
it's good for like oily prone skin or acne prone skin.
Okay.
Um, yeah.
How do you feel about which I see there again all over social media and people talking about I think it's Ordinary, the brand Ordinary.
Yeah, they have a lot of good products, and I think a lot of their products are like nice and natural, and they have like a clean line. They have a great azelaic acid topical. That's something that I think is sometimes I just tell patients is maybe like an extra step in their routine if they want to, if they're already doing the basics and they kind of want to take it to the next step. But azelaic acid is good for like brightening, oil, and then also like acne prone skin too. So sometimes if like they're tolerating their routine great and they want to take it up another notch, then I'll tell them start using like something like the Ordinary, and they have a great azelaic acid product.
Okay. Yeah, I know a girlfriend uses it and she just raves about it. She loves and it's not expensive at all.
No, I think it's like $11 for like
Yeah,
that too.
very
Yeah, it goes a
affordable.
long way.
It does. Yeah, that's what she said too, is a little bit goes a long way.
Mhm.
So, yeah, because I'm thinking, gosh, I've been using is it CeraVe or CeraVe? How do you say it?
I like calling it CeraVe.
CeraVe. Okay. Yeah, I've been using that for forever too. And so she's been raving about it. I'm like, well, maybe I'll give it a try. And I'm thinking, well, maybe I'll ask you before I give it a try.
You know, and I think it also depends to like what when patients ask me about like cleansers or moisturizers, I always ask them to like what is it that you want to achieve in your skin? Because if you're
Mhm.
looking for just like something like daily, kind of like basic building block, then I think those products are great. If you're looking more for like brightening, anti-aging, then I might kind of like redirect and like suggest like a glycolic acid wash. There's one by Glytone that's really good that's got glycolic acid in it that's good for like brightening and oil and acne too. So it all kind of depends on like what your final outcome is for your skin.
Okay. What products do you think are, or I guess not products, but companies, do you think are underrated or overrated?
Oh, that's a great question. You know, I really like The Ordinary. I think they are a great
Okay.
company and they have a lot of great products. Paula's Choice, I think, is also like a nice similar line where they have a big selection of things with some of the basic ingredients. Neutrogena actually has quite a few things that I like too. Overrated, I don't know, maybe Clinique. I think they have a lot of different things mixed in their products. So when someone's trying to use something for like acne prone skin, if they throw in something that's anti-aging, it sometimes it turns into more of like a mess.
Mhm.
Or if they use certain anti-aging things, I think they try to add too many ingredients, and then a lot of patients will get like reactions or irritations from them.
Yeah, I wore Clinique for quite a while. I also think that I my mom was always very sensitive to different, well, still is very sensitive to different products. And so I think I latched onto that, like, oh, she has
Mhm.
the problems, so I must have the problems. Because I used to
Yeah.
use the same products she did, and then I kind of switched over to MAC. What are your thoughts on MAC? Actually, now that I say that, because that,
I like certain MAC products. They do tend to be like a quite oil based, so I don't think they're great for like acne prone skin because some of
okay,
the like if you have a lot of acne or blackheads, sometimes it actually makes that problem worse. So I do want patients to go toward like oil free or like non-comedogenic products. If they're more acne prone, MAC is just like such a thick formula.
okay. So yeah, so I switched to Mac and I didn't have any issues. And so I've been little by little experimenting with different things and I'm thinking, well gosh, maybe I'm not sensitive to all these things and I just I just assumed I would be since my mom was.
You can probably try and experiment a few things, and like there's so many different products out there now that you can try even with like a free trial.
Proactive. What do you think about that for teens? I have a 16-year-old and almost a 14-year-old in a couple weeks. She has exactly my skin. I had nothing growing up. I didn't have anything till like my 30s and then I started would get like if I got something it would be one of the cystic type things.
Hmm.
Hers skin is exactly the same way. My
Hmm.
son has a little bit more acne. He comes to your office actually. Some more acne, and he's got some blackheads. So if you don't get medicine, is
Hmm.
the proactive something that you think is a pretty good product?
I do like the proactive products. I think that they bundle everything at once that sometimes patients might be too dry when they use all together. So it's like the proactive wash I think is great. It has benzoyl peroxide that can be a little bit drying. And then they usually have patients start like a different gel at night. That can also be a little drying, but it helps with blackheads. So I think the main type of person that can tolerate that is like a very oily skin type male, teenage male that can handle it. So if they're doing these things consistently, like washing every day with something drying and putting something drying at night, a lot of patients, especially females, will get more irritation. They're sometimes more like sensitive skin. And then their acne is sometimes a little bit different too. It might be more like cystic hormonal. So what works for them may not work for males.
Sure. Yeah, because now that I'm thinking about it, I don't know what my son's skin is, if it's oily or dry. I honestly don't know. If you have a lot of blackheads on your nose, is that just hormones or probably just his skin type for right now?
It's probably just like so it's usually something like that you inherit, like the skin type that you have. And then of course, if like you're in sports or sweating, or if you're
Yes.
going through puberty, hormones, all that will aggravate it. So,
Okay.
but I mean, blackheads are pretty common on the nose, and that the different gel, like from the Proactive line, is great to use for that. Sometimes if patients don't have acne anywhere else and it's just the nose, I just tell them just use it in that area. Normally, I recommend like using it all over when they have like active cystic inflammatory acne, but if it's just blackheads, if they use like something like different all over the face, then they can get pretty dry from it.
I see so many kids who have such bad acne, and I'm thinking it's so unfortunate. Like, so is it possible for kids to? Because I just assume that they're not going to a dermatologist. Like, I would have never been able to handle that even as a child, let alone see my kids go through
Mhm.
that. So, if is it possible that they come to a dermatologist, but it's just their makeup that they're just going to have to something that they just have to suffer through?
Well, they say about 90% of teenagers will have acne at some point in the teenage years. So it is like very prevalent, especially in the US. And, we can leave it untreated, and a lot of parents do. I never went to a dermatologist till I was a teenager and I said, hey, this bothers me.
Okay.
So it isn't something that they necessarily have to deal with. There are things that can make it better, whether it's like topicals, creams, gels, even like pill medications. Then you
Hmm.
have something like Accutane, which is like a big, strong medicine, but it is really effective. So, patients like don't have to suffer through that, especially like teenagers in the years where they're not feeling like confident about themselves. There are definitely things that we can use that can improve it, or if not, get rid of it for the most part too.
And if they're not coming to the dermatologist and they have real bad acne, your best advice to find something at at a Target or a CVS or something would be what? To get a good face wash to get a good, if they're trying to do this on their own, what would you
Mhm.
suggest for
Well,
that?
I do like that proactive kit for those patients.
Okay.
I usually tell them though, if you're using something over the counter, like try it for 3 months, like 3 to 4 months. And if you're not seeing results, we probably should try something else. A lot of parents like don't want their kids to be on anything. And then they don't realize though that if you have like cystic acne, some of that can lead to scarring.
Stars.
So if they don't know that, they might just let the kid go on and then it becomes like a permanent thing once the acne is actually all gone and they've grown out of it. Then we have to deal with treating the acne scars, which is sometimes harder than actually treating the acne.
Especially with sports, the sweating and,
Mhm,
well, even for lacrosse, he would get a patch here from his headgear and
mhm.
then football, I think that definitely makes things worse when you have sports involved.
Yes, yeah, both my boys are in sports and my older son is starting to get some of the white heads, and it's like, I think the style now is to have like longer hair and longer bangs.
Yes.
He's got a little bit of that, but you know what? I've asked him if he wants to treat it.
Yeah.
Obviously, I'm like a dermatologist and his
Right.
mom, and
Like,
he's
you're
like,
my
you know
son. I
what?
can't have you walking around with
I know. I said,
acne.
can I just put this on your skin? Like when you fall asleep, if you don't want it on your skin. He goes, you know what? These bumps make me unique to me. He's like, I'm just gonna keep them until I want to treat them. I said,
Wow.
I
Look at
said,
him.
yeah, I said, you know what? Then you keep them. Like if it doesn't bother you, it doesn't bother me. They're just small little whiteheads.
Yeah.
Maybe I'm the only one that notices them. So I said,
Right.
that's fine. We can just do whatever you want.
At least you're building a very strong, confident man.
I know. I was like, you know what? I'm gonna leave these. They're gonna give him character. So,
Exactly.
and maybe when he's older, he might reconsider that or have a different opinion. So, we'll just see. He's 10, so he might
Yep.
have some different thoughts.
Yeah. When he comes, yeah, 13, 14, he'll be like, no.
Yeah, yeah, it might change.
How does skincare routines differ throughout ethnicities? Because I would think that it's different.
Yeah. That is a great question because when you see skincare products, you don't really see it marketed toward like any specific skin type. So it's like there's so many out there. Like, how would you even know what to use? But
Right.
typically, the more olive skin tone, the more hyperpigmentation that they can get when it comes to like having acne or an inflamed hair follicle or things of that nature. So with that skin type, I just recommend maybe more like skin brightening things because the concern is usually more of like pigmentation. So products that have like glycolic acid in it. Sometimes we'll even do something called hydroquinone, which is like a prescription that we prescribe. It's almost like a dark spot fading ingredient or like a bleaching ingredient, but that helps like even out the skin tone if there's a lot of like pigmentation and what we call post-inflammatory pigment, like after something like acne. Right. And that's the same thing that when I ask patients of skin of color, I ask them like, what is your goal with your skin? If it's brightening, if it's like smoothing, if it's acne, it all depends on like that individual person. So it's kind of like I try to pick and choose what things are going to be best for them. So not everybody's going to have this like cookie cutter regimen.
Do a little switch here and talk about what is so, I'm sure, popular is your Botox and, well, let's just start with Botox.
Mhm.
Botox is just highly
Oh
coveted,
yeah,
I would guess.
everyone's got Botox these days. Yeah.
Actually can start off by asking because someone wanted to know people in their 30s getting Botox or fillers as a preventative.
Mhm.
Is that a thing? And is that true? Is it
Yeah.
preventative?
It is definitely a thing. We call it like baby Botox, which is
Yes.
before we develop these like thick lines or like etched lines in the skin, these like deep grooves. If we can like soften that muscle and prevent like a deep wrinkle from forming, that is a little bit preventative, like down the road.
So that is a thing that works?
Yeah. Yeah. I started in my 20s and I've been using it for a long time now. And I think so when my Botox wears off, my lines I think are much less deep than they would have been if I hadn't started it.
But now if you stopped altogether,
Hmm.
would would it then start the aging process? I'm sure I'm not saying this right, but would it then start the aging process normally, or would it all of a sudden
Well, so
jump
certain like
stages?
toxins last anywhere between like 3 and 6 months. So really what they work on is actual muscle that causes like that line to form. So if you keep consistent enough with Botox over time, you're like weakening that muscle. So like my muscle probably wouldn't be as strong now because I've had Botox for so many years than if I never did it at all. That muscle would be full movement. It'd be very active. I probably have much deeper wrinkles than if I hadn't been doing it all this time and like training this muscle, like not to quite move as much.
I've had my 11s done. That's what they're called, right? The 11s.
Hmm.
Yeah, I mean, I'm sure I need them again. But because there again, like I don't have I, I don't have many wrinkles, thankfully, there again, but those were driving me nuts because it gets caught in your makeup, and I'm
Hmm.
very expressive through my eyes. Um,
Yep.
and so, I don't have anything like this, but I definitely have the 11s. And
Hmm.
so, yeah, I was very pleased when I'm due to get them again. I don't even remember the last time I got them, but I was very pleased. So, is that the most popular? Would you say it's the most popular place?
Yeah, I would say it's definitely a popular place because even if you don't have the 11s, like if we inject here, that actually like lifts our eyebrows because this muscle group just, I have some Botox in here too now, so I can't do it so much.
Yeah,
But that wrinkles like these
I'll do it
muscles
for
and
you.
it pulls them down.
Also, like
So
through here.
yeah, so when we inject through here, it actually raises the muscle and I have like more space. So like let's just say put on like makeup. Otherwise, it's like my lid hangs lower. So I can see it when it wears off in pictures when I kind of need to do it again because it's like I have more like real estate on my eyelid to actually do things with. And I get
Okay.
it on my eyes too because this whole muscle group is like a circle. And when we do it, it like raises like the tail of your brow and it helps like with the crow's feet. So I would say those are the two most popular places to have it done.
So you do it through here, and then where if I just wanted my 11s done, you would stop throughout here.
Yep, it's like this little V muscle that we have
Oh,
that
okay.
does that. Yeah.
And then if I wanted to do like crow's feet, then you would do a
Yeah.
couple
We
around
usually just
here.
kind of focus like on the edges here.
Okay. So where else are where's the most popular?
Well, forehead, I would say a lot of people get what we call like the lip flip, and then we put a little bit in our lips, and that kind of just like helps like soften this like little muscle here. So it's like we start noticing like, these like tiny little fine lines like around our mouths, and then
Okay.
this becomes a much more stubborn area to treat with time. But using that lip flip is kind of like a little baby Botox in the lip area.
Oh my God, I can't even like people who get lip injections, that's got to kill.
There's like numbing creams and like dental blocks. There's ways to make it more comfortable.
Yeah, because I mean I'm not I wouldn't mind getting a little of that done. No.
Yeah, and I would say if you're hesitant about the fillers, you can always start with just a little bit of Botox. That helps kind of like turn the lip up a little bit and like soften that muscle. And then that's kind of as much as that's going to do. And then the next step is something like filler.
So people who have that little flip, that's Botox,
Hmm.
not lip injection?
It might be a combination of both depending on like the
Oh,
person, but I would say you could always start with just a little bit of like Botox just to like soften that muscle, just to reduce like those little tiny fine lines. And sometimes it does make the lip look a little bit more plump because it's actually just like everting the lip area.
okay. Well, real quick, what services do you do in your office? So Botox, you do the fillers in your office?
Yep, we do Botox. There's other brands too. We have one that we like a lot called Daxify. That one lasts more like 3 to 6 months. There's things like filler, lasers, things for acne scarring, wrinkles, texture, pores. We have a device that's for skin tightening called Silifirm. I like that one a lot too. So there's IPL, that's good for like brown spots and redness on the skin. So there's something for kind of every skin concern basically that we have.
What about the those masks that you see now, those red light masks that it's funny how something will pop up and then that's all you see. So there's that one and then that handheld light that I see everywhere too, where people are,
Hmm.
scraping up with their face with it. What are
Yeah.
both of those for, and do you believe in them?
So that those are red light based and that has like some anti-aging benefit to it. You know, and I think they're great. I don't have one. You do have to use those pretty routinely. I'm not someone that's gonna do something like that 20 to 30 minutes a day. I just don't
No.
see myself like investing and committing to that amount of time. But let's just say they want to do something like that instead of getting like a laser procedure. I think that's a great place to start, as long as they're consistent with it. Because if you're only gonna use it once, this is just like never gonna work.
Okay. So you think that's a daily
It's a
thing?
really regular thing that you have to do.
And then what about the handheld light one that I'm seeing everywhere?
That's kind of the same thing in like a smaller version. The mask is a little
Oh.
bit more expensive. I think that that mask tends to run around like $400 for that mask. The handheld ones are a little bit smaller, but then you have to like do multiple areas of your face with it. So you're not doing it all at once. So it might actually take longer than the mask.
And is there a difference between the red light and that white light that they have in the handheld one?
There might be red light in that mask or in that handheld one. There's something else called blue light that's more for like acne prone skin. So it's a
Okay.
little bit blue light is more anti-inflammatory. Red light is a little bit more like anti-aging. But I would say long term, I don't know if the difference is going to be that noticeable. Things like Botox filler laser, you're going to notice a lot quicker than something like that.
What tips for listeners would you give them if they're considering any type of cosmetic treatment? Some things that they should think about before they come in and schedule the procedure. What are just some things that they should think about before they do that?
Well, a lot of patients want to do things like Botox, but then they'll never use like a skincare routine. So I tell patients like you have to be sort of on like some sort of like starter skincare routine because anything else that you do is going to be an investment. Whatever products that you're going to be using at home that you're consistent with is actually going to make those treatments last a lot longer. So I tell patients that are going to do laser treatment for like brown spots and pores, like if you're not using vitamin C and retinol every day, we're going to be doing this again in like 6 months to a year. You're going to get more out of your investment in those products if you're doing like a good skincare routine. So that's kind of like very basic like starter point that I'd want patients to know. It's like you have to use those things on a regular basis.
Okay, so good skincare routine, cleanse, moisturize, sunscreen, and for our age group, retinol you say is great,
Yep.
and vitamin C.
Vitamin C. Yep. Those are like the basics.
Okay, so those, if you've got those, if that is included in your skincare routine, then you're doing better than most.
Better than most. You're at like at least an 80th percentile for patients who are using products. If you got those basic things in, like you're like light years ahead of everybody.
Okay, and then someone who's doing that would be a better candidate for Botox.
Well, then when they do those things, it's like the benefits last longer because now it's like you have less wrinkles, but you're also going to have better skin texture, better skin tone. You're going to get
Okay,
more out of that investment. Recommend too to patients is like when you get your skincare, whatever you're using, like I have this like little container that I put my toothbrush in and my toothpaste. And it's like I do that and all my skincare's in this like little container. So it's like at night, I just like take that out, brush my teeth, and I do my steps and then I put it back and then at night I brush my teeth, do my nighttime stuff. So it's like there. So it's like there's no way that I cannot like miss it.
right.
So it makes
I
it like super simple and like accountable.
I find that nighttime one, I literally will sometimes stay up like an hour past when I want to go to bed, all because I
Mhm.
still have to wash my face.
Yeah.
That,
But
that
it's like
nighttime one is hard.
if you get into this routine, it becomes where like you feel guilty like when you don't use it.
Yeah, I don't think I could sleep if I had makeup on my face, to be quite honest.
Mhm.
Like, I'm so trained to wash my face before I go to bed
Yeah, you
that
feel terrible if like you don't wash it or if you like don't use your nighttime step. It's like I know if I don't use it tonight, tomorrow my face is gonna be red or flaky or whatnot if
yes,
I didn't do what I was supposed to do.
yeah, it's that has always been something big for me. Oh, you know what I did remember? Um, the skincare routines that are going on with these teenage girls.
Yeah.
What are your thoughts on that? That is definitely something I wanted to talk about because my daughter is full into it, and I know all
Mhm.
her friends are too. She's got more skincare products and a routine
Mhm.
that I have ever had in my whole entire life.
Yeah, they say that 90% of the gift cards sold at Ulta and Sephora are in 11 to 13-year-old age groups. So
I
they
don't
are
doubt it.
marketing very heavily, especially like on TikTok and like social media
Yes.
about things that they should be using. And I think if you start like a basic routine, the earlier the better. But there's things that I don't think that they necessarily like need. I don't think they necessarily need anti-aging ingredients at that age. It's like it's great if they start a routine, but maybe something tailored toward like their skin type and age. I don't think they have to be using all these like complicated regimens that have like 9 steps in them.
Yeah, she definitely does all of those. She's got like a serum for everything. And she'll say, "But look how beautiful my skin is." I'm like, "You're 13. It's supposed to be beautiful."
Exactly. What would it have looked like without the serums? I guess, we don't know, but we do see a lot of irritation from teenagers that are overdoing it with these skincare products.
Sure. Long-term side effects for using.
Not long term, but the short term, they'll have like redness, irritation. It almost looks like they're creating an eczema on their skin because some of the products are like too abrasive, where they're not really their skin isn't more like oil based or a little bit more resilient, where they can use some of these anti-aging things. So they'll have a little bit more irritation from the products.
Okay. Yeah, I knew that was one thing I really wanted to talk about because God, she is into it, but
You know,
she
we've
knows
seen a
way
lot
more
of
than
these,
I
like
know.
we've seen a lot of these, like, masks that girls use, and
Oh,
sometimes
yes.
they're, like, tinted, so I've had patients come in with, like, a pink face because it's literally, like, the dye from this mask that, like,
Stop.
stained the skin, and it's temporary, but you know, they might walk around with, like, a pink stained face for a few days.
Like a pink
So,
koala, you know what I mean? Because 'Cause they're
yeah.
usually
Or like eye patches. I've seen a young girl with eye patches, and I said, "Well, what are you using on your skin?" Then she admits, like, "Okay, I'm using these things that I got at like Ulta, and they just kind of create a little stain in the skin." But at least it's like we found out what the cause was, and it's just temporary.
Sure. That's amazing. These darn girls, just
Sometimes
slow it
it's
down.
impressive. Yeah,
Yeah, they need to slow down that aging, and then they're being too grown trying to do all this skincare stuff. But she's in it with the makeup and everything too, so she's full in the TikTok mode. I don't
yeah,
think there's any getting her out of it anytime soon.
yeah. Thank you, social media.
Exactly. Well, thank you so much for joining me today. I really appreciate it, and I will give your contact information and where you can be found. Thank you for joining me. As always, do better, expect better, and be better. And remember to always laugh through it all. Don't forget to check out my Shopify page where you can pick up some Do Better merchandise. Link will be in the description.